Good morning and welcome to the Charleston VA Medical Center. I'm June Robbins, Program Analyst within the Veteran Experience and Community Engagement Service Line.
And I'm Felicia Cully, the Implementation Specialist within the Community Engagement and Veteran Experience Service Line.
Today we're going to share with you some current processes that we have in our facility to improve our patient experience. For the past 3 years, we have been sharing provider-level data with our providers. Sharing this provider-level data allows us to share their scores, benchmarking among their VA peers and also private facilities, and as well as comments. Initially, we had providers who were hesitant about believing in this data, but now these same providers are seeking out their data on their own and have requested their own Press Ganey account so that they can do process improvements within their own areas. The Relationship-Centered Care, or RCC, has allowed us to drastically improve scores through our facility for sections like rating a provider, provider spending enough time with you, courtesy and friendliness of the provider. Providers who have taken this training, they now more than ever are connecting with their patients and showing true empathy. We have had multiple classes so far that consist of nurse practitioners, physician assistants, MDs, and social workers. One key part of using Press Ganey is the importance of mapping the providers. With mapping, we want to ensure that we only have providers that are currently at our facility. We want to make sure that their numbers are correct, so when we provide this data to the providers, that they are confident in their scores.
Our RCC workshop was scheduled at an off-site location to give providers the ability to be able to focus on the daily training and not be distracted from their everyday work. There were 12 students scheduled per workshop, 2 providers. The agenda was from 8 to 4. There was training provided, and for each training that was provided, there was a break for training implementation to be done. By midday, the classes were broken down into 2, so there were 6 students per provider, so they could again go over everything that they were trained and put it into everyday work.
Hi, I'm Hugh Myrick. I'm the Chief of Mental Health in Charleston, South Carolina. I think we'd all agree that customer experience, patient experience is paramount to any industry that we're in, certainly in healthcare. For me as a chief of a large service line, being able to look at aggregate scores for that experience is one thing, but really being able to target down to the individual level is what I really need. And when looking at just this individual data, one of the things that really struck me was so much of it involves communication.
Absolutely.
As healthcare providers, we get all this training in the clinical skills that we develop, and we actually get very little in the way of the skill we use most every single day, which is communication. One of the ways that we've targeted to increase those scores in Charleston is through relationship-centered care. As one of the facilitators, one of the best pieces of feedback that I got from one of the senior clinicians that had gone through the training was the awareness of a skill set I wish I'd had for the past 30 years. That's very powerful.
It's super powerful. And I'm Sony Adams. I'm the Chief of Social Work. And I had the privilege of participating in the training. And I just found it so refreshing to be able to pull into an authentic space in which to value people and what they present to you at the table. And I think that that's so critical for us as healthcare workers. We're so busy trying to meet different metrics that sometimes we fail the patient. And so the ability to be able to engage in that and to develop those tools was just a really great experience.
Hi, and I'm Dr. Simon Scalia, and I want to reiterate exactly what my colleagues have just talked about. One thing I noticed when I came from the private sector into the VA, that the VA is able to collect lots of data on our service lines. I'm currently the Deputy Chief of Staff. So when we look at data, we can say, yeah, this service line is doing a really good job of making our veterans feel like they're understood and heard. And yet when we look at it, we have a hard time trying to figure out how some services are really good at it and some aren't. Having individualized data where we can actually drill down and see which providers are really good at communicating and making our veterans feel understood. We were able to take some best practices. Press Ganey is able to give us that information, and we can now transform some of our other providers who aren't so good at this into understanding what tools they need to be better. The relationship program that we developed here allows all the providers to pick up those tools, which are extremely valuable in letting our veterans understand that we do understand them and we do value their input, but it allows us the mechanism to capture that for our veterans.
And I think what's also very important about a relationship-centered care is it's an evidence-based skill set that really not only makes the patient happier, but the providers are actually happier in the care they're delivering, and they're more efficient. So it's kind of like you get three things that are really positive for everyone through these techniques. So it's really been incredible for me to get the feedback, the emails from folks who've gone through and say, hey, listen, I used X skill and it really works. So it's really, I think the light bulb really turns brighter for a lot of folks once they gain additional skills in just communication.
And they also work at home. So the communication skills can be actually extended to our interpersonal relationships with others, including staff, including being able to communicate efficiently, effectively, and with compassion with your staff.
And exactly as they just commented, it's hard for most practitioners to understand how they can become more efficient. Their immediate reaction is, oh, this is going to take too long, I don't have time for this. But once they really utilize it and they realize that they are indeed more efficient at what they do and they have a better outcome and their satisfaction goes up, so not only does the veteran have better satisfaction, the provider has better satisfaction, and in a reduced period of time. It's pretty amazing when you think about it, but it actually does work.
And a lot of folks, I think, come into that day of training really thinking that, well, they've got all the skills they need. And it's those folks who up front are a little hesitant that actually on the back end are the folks who make the most gains. And so it's going to be interesting to see just the change from the aggregate data down to the individual data, and now to look at our folks who've gone through the evidence-based training to see how it's really impacting the scores that we're getting on both the individual and the aggregate level. One of the things that we all know from the data is that effective communication leads to positive patient outcomes, whether it's compliance with medications, compliance with appointments, just compliance in general is really impacted by the communication skills that we use in our patients.
So one area that I think is really important is that when we often meet with our patients, we have our own identified script about what we want to talk about, what our expectations are. By flipping the script and giving the patient the opportunity to clarify what they need, it gives us an ability to address what they're bringing to the table and then fold that into clinical care and improved outcomes, because they feel understood, they feel supported, and they feel heard. And then we can follow up with that by being able to make sure that we've identified all of the issues that they've come to the table with, or at least identify which ones need to be addressed and prioritized.
Right, that's very well said. One of the key agendas when a patient is sitting in front of you is you know what you want to talk about, but you don't know what's really important to the person in front of you. And when you allow them the few seconds literally to voice what's really important to them, then you can marry your concerns with their concerns, and they understand you and you understand them. And I think that mutual working together is what really makes the difference, and that allows them to actually buy into what you're saying because they feel you're buying into what they're saying. So it's really very, very effective.
Yeah, and I think the scariest term that we bring up in this training is getting the list of all concerns. And it's pretty shocking to most clinicians to hear that, getting a list of all concerns. But that literally only takes a few minutes and sets the tone for what the agenda should be compared to what we think it should be.
Because those agenda items are going to come up whether or not we flush them out. So a lot of times it's helping the patient to identify that the list that they have very much is the same list that we have. So then we can go ahead and we can help them to kind of identify what's the most important.
Right, and getting that information up front really does eliminate what doctors dread, is that hand on the door saying, and by the way, what about my headaches or whatever concern that you didn't address during their visit because it wasn't brought up. Allowing them to bring that list, even though it strikes fear into the heart of providers, is actually very, very effective.
Yeah. And there's your time savings. You don't have to
Yeah.
wait till you hit the door
Yeah.
to get the most important thing to
Out.
them.
Right.
My name is Fred Lisinski. I'm the Chief of Veteran Experience and Community Engagement here at the Ralph Johnson VA Medical Center in Charleston, South Carolina. I remember about 4 years back talking with the Chief of Surgical Service and presenting our SHEP data to him. And he said something along the lines of, in response, "That's great, who do I need to go talk to?" And then it became very apparent to me too that we really needed to have individual provider level data if we were going to be able to influence aggregate or service level data within our services. So earlier June Robbins had talked about some of our individual provider level data where we're looking at the communication domains, and that really demonstrates the importance of having that data at the individual level. As we started to implement our relationship center communication program here, the best way for us to determine its effectiveness is to be able to measure trained providers' performance versus untrained providers' performance. And as you'll see in a second, what we found was that our rating of provider for those who had gone through the RCC training was a full 5% higher than those who had not gone through the training. As we analyzed our data, one of the things that really stood out to us was that compared to the private sector, and we looked at their measurements versus ours, from rating a provider, we found that even though our VA is a very high-performing VA and in the top 15% of VAs, that 84.5% of our providers were actually rated lower than the 50th percentile compared to non-VA providers. And that really demonstrated the need to have an intervention. Earlier you heard Felicia talk about our RCC contract and our training program. And that was really derived from some research that we had done about trust and what drives trust. And what we learned from a massive amount of research was that communication was really the solution to improving trust. As you know, we measure trust through V-signals, and we also do it through our Press Ganey contract. But we knew when we wanted to improve trust that we had to improve the communication skills of our providers. And that's how our whole RCC program was born. We have this broad data that the VA uses for our past performance. It's really not useful for performance improvement. We use our Press Ganey data at the individual level to be able to have provider level data so that we can monitor individual performance, because that's what's contributing to the whole. And then we have an intervention that we can implement, and then we can measure the outcome of that intervention on those individual providers. So we go from intervention to provider to aggregate performance improvement, and that's how we're going to improve patient experience at the VA.